Allergic reactions, another common thing, especially coming into the spring and the summer months, we'll see through the emergency service, and a lot of you may see at home or out in the field as well. Allergic reactions are very, very common in dogs, and these happen and in cats as well. Cats, they probably go a little bit unrecognized, because what do cats do whenever they get sick or they don't feel good? They go hide underneath the bed, so you won't see them forever. Well, if it's a Labrador, if it's a little pug or something, and as soon as they get sick, they want to show it to you, so they're in your face. So we see it, I guess, more in dogs than we do in cats. Insect bites and stings are probably the #1 cause of allergic reactions that we see. We don't see, or at least we don't appreciate, things like peanut allergies and things like that. What we'll typically see is swelling of the muzzle or of the face, and then swelling of the eyes. They'll start pawing at their face quite a bit. The other thing is we'll sometimes just see hives generalized all over the body or all over the face. Those are both signs of an acute allergic reaction. And most of the time, we can treat those patients effectively with just antihistamines, typically like Benadryl, and then sometimes we'll use something like a steroid. So we can't, if you call into us and ask for a dose of Benadryl or ask for a certain medication to give your pet, unfortunately we aren't able to give you that information because we don't have you're not one of our patients. We don't have what's called a client-patient relationship or a doctor-patient relationship. But what we can do is advise you to talk to your veterinarian, and most veterinarians will be happy to give you just a routine dose of Benadryl for your dog and be able to advise you to give that in the case of you see symptoms like an allergic reaction. And Benadryl oftentimes is good and works great for these patients. But if the swelling progresses, the pets start to, they're really itching at their face, they really don't look good, they're lethargic, then at that point it's probably best that you see a veterinarian, because what can happen is that mild reaction can actually turn into or be the beginning of an anaphylactic reaction. We've seen a few of those, especially those dogs that get stung by multiple bees or something. They'll start potentially having vomiting or diarrhea or collapse. Those are all signs of a severe reaction. If it's just a little bit of swelling of the face and itching, that's considered a minor reaction. But when we have these, what we call systemic signs, or the whole body is involved, like the vomiting, the diarrhea, the collapse, those are all signs of a potential anaphylactic reaction, and those need to be seen immediately by the veterinarian. Things we might do in a hospital setting, again, is still give those corticosteroids or give the antihistamine. We also potentially use epinephrine in that type of situation. Talk to your veterinarian about that dose of Benadryl. Typically, it's about 1 milligram per pound of body weight, and we can dose that every 8 hours or 3 times a day. But that dose range is pretty variable, especially if there's other medications that your dog might be on, if your dog might be sensitive to certain medications. So it's going to vary a little bit. Again, anaphylactic reaction is that severe reaction to where it really progresses to the whole body is involved. Sudden vomiting, diarrhea, weakness, lethargy, collapse. If their gums are pale, those are all signs of that reaction potentially happening. And you want to seek veterinary care definitely immediately.